November is National Diabetes Awareness Month. 26 million people in the U.S. are living with diabetes, according to the Center for Disease Control, and many of those people are of African descent. One of our guests today has literally been on a long journey to help build more awareness about diabetes. Sterling Cleveland walked for 8 months from New York to Los Angeles. Also joining us is Amy Fair. She's the founder of the organization Fair in Action, and Dr. Aletha Maybank, the Assistant Commissioner of the New York City Department of Health. Thank you all for being with us this afternoon.
Thank you. Thanks for having us.
I'm going to start with you. What prompted this nearly or more than 3,000-mile walk?
Well, at first it was curiosity about the rest of our country. I wanted to get up close and personal and see what the rest of the country was about. And, you know, I'm from the East Coast, and I've always wondered about the Midwest and Indian reservations and the West Coast, so I thought that would be the best way to do it. And also, I have a deep curiosity for things of the unknown. So that was what started the walk. But shortly after starting it, it became a dedication to diabetes, and through donations and also awareness, bringing awareness to it.
And you were walking because the grandmother who raised you suffered from diabetes.
Yeah, absolutely. She suffered from diabetes, and just seeing what she had to go through with the medication and the insulin and the dialysis, it was something that I wanted to, like I said, raise awareness for, and also bring a huge sum of donations for.
Okay.
Yeah.
And Amy Fair, Fair in Action.
Yes.
You started this organization. Both of your parents suffered with type 2 diabetes?
Yes, they did. My father passed away from type 2, and my mother currently has it.
And Fair in Action, what are you hoping to do?
My goal is to bring awareness to the community, predominantly the Bronx community. I'm a Bronx native. And out of all the boroughs, the Bronx has the highest rate of diabetes. So I would like to empower our youth and our people in our community to take better care of themselves so they can live long, healthy lives.
And I understand that your grandmother suffered from type 2 diabetes as well.
Yes.
So this is where the expert, Dr. Maybank, comes in. You're telling us there's 3 types of diabetes. Why don't you explain that to us?
Right, so there's type 1, type 2, and as well as gestational diabetes. And just to explain what happens in diabetes, you know, your body produces glucose, and when you put food into your mouth, it's converted to glucose. In order to regulate the glucose, you have something called insulin, which many of us have heard of. Insulin really helps create, you know, it decreases glucose if it's too high, or it helps, you know, glucose come out into your bloodstream as well, produced by your pancreas. If there's something wrong with insulin, if your body can't make it for whatever reason, or your body becomes resistant to it, you have this likelihood of creating or getting diabetes. And so it depends on what is exactly happening with that insulin is what type you have. So type 1 we usually see in children. It's usually an early onset, and it's usually really insulin dependent. You have to have insulin shots. You've probably heard this when young kids have to have insulin shots. Type 2 is the most prevalent diabetes worldwide. About 90 to 95% of diabetes cases are from type 2. That we used to call adult onset. However, with the obesity epidemic, we're seeing children develop type 2 diabetes at an early age because obesity is a significant risk factor for type 2. And then there's gestational diabetes, in which a woman gets pregnant and sometimes she can get gestational diabetes. Many times it resolves when she's finished, when the baby's delivered. However, she is at an increased risk of getting type 2 diabetes down the line.
Because she dealt with gestational diabetes.
Correct, and also one of the risk factors, you know, and especially in African American women, which we know our obesity rates are much higher, obesity again is a significant risk factor. So chances are she was probably obese during her pregnancy as well.
Well, let me ask you, Dr. Maybank, why is it that we see such high rates of diabetes in communities of color?
Sure. I think a large part of it has to do with our obesity rates. And then if you go back, so why are we, you know, obesity? I'm sure we've had, you know, shows, or you've had shows on this before, but many of it stems from our habits related to diet and exercise, and then all the things that influence that. So the communities that we live, you mentioned you're in the Bronx. And we know there are certain communities across New York City and the country that have factors, whether they're social factors, economic factors, lack of fruits and vegetables, food deserts. We were having that conversation earlier, you know, in the green room, that our communities suffer from those kind of experiences and environments that influences the choices that we have. And then culturally also, you know, there's a lot of things that have been passed down that we do as far as eating. We eat a lot of food. We cook foods in a particular kind of way. And so that impacts our health. And then physical activity, a big part of it. And you know, you walked for diabetes to raise money, but then you also walked, which is a great thing. Exercise is a tremendous, tremendous way to really even, not only if you have diabetes, you can actually decrease the levels of your sugar and how your body's dealing with the diabetes. And some people have actually gotten rid of their diabetes somewhat from so much exercise. Absolutely. And so exercise is very important.
And I'll ask you, Fair in Action, what are you exactly trying to do with Fair in Action? Are you teaching people about some of the things Dr. Maybank talked about, exercise, diet, changing? It's hard sometimes to change habits.
It is, because I came from a Southern background. So for myself, I'm used to eating very rich foods, but I too had to take ownership on being more proactive and watching my food intake, especially because it runs in my family. But in regards to Fair in Action, I have worked with schools, and bring awareness. I actually had created a kids walk. We had 200 kids walk for diabetes, and I basically provide them with different resources on what it is and what we can do in our homes, our everyday shelves, what's in our cabinets, and what we can do to live longer, healthy lives.
You know, it's interesting because sometimes you tell kids what to do, and they will take it home.
They sure
will. Keep reminding mom and dad whether it's what they're not supposed to eat or smoking. Do you find that they really absorb what you're teaching them?
My daughter's 5 years old, and she's familiar with diabetes. She'll say, Nana has diabetes, and she'll talk about it with different individuals because she'll watch my mother take her insulin. And if I get some coffee, for example, and I put sugar in it, she'll say, Mommy, that's too much sugar, you're going to get diabetes. So just from her having that education on understanding that Nana is sick with diabetes, it does depend on your diet intake. You do need to eat healthy in order to live a longer, healthy life. I see it within my household that it does work if you provide them the right resources.
And Sterling, you know, as a young man, I look at you, Mr. Slender here. Do you find that people your age, you know, you have a hard time getting that message across about that this does relate to them? Because sometimes we tend to think, you know, that's an old person's disease or an older person's disease. But you've become aware of it because of your grandmother. Do you feel like you can get that message that it's important to look at your diet and your exercise out to young men and women your own age?
Yeah, absolutely. As I was walking, I was spreading that message. I did get a chance to speak to one high school body in Colorado, and they loved the message. Like, it was almost like they haven't heard it before, especially from someone that's, you know, relatively, you know, their age, you know, compared to their parents.
Yeah.
So I think a lot of people, especially if you talk to them while they're young, you have more of a bigger impact on them than they are in later years.
Yeah.
So definitely.
Because the doctor said a lot of it is about habits. And what about you, watching your grandmother go through that? Has it really affected, you know, how you eat, how you treat your body?
Absolutely. I mean, she passed away when I was about, I would say, early 20s. And yes, but even before then, I was seeing the way she was eating or you know, not getting enough physical exercise, and I kind of did the opposite. So I changed up my diet, you know, eating more plant-based diet and a little less meat and staying away from the sugar and just being physically active, whether it be running, hiking, camping, biking, or whatever. So yeah. It's definitely important.
It sounds like he's doing all the right things.
That's a commitment and exactly what you need to do. And I think we need to really learn and understand that diabetes does not have to be in our community. I think we have this knee-jerk that we're black people and we get diabetes, and doesn't have to be the case at all.
How difficult is that, though, changing some sort of cultural, you know, almost cultural norms in a lot of instances? Like you said, well, so-and-so has diabetes, my mom has it, my dad, and then people sort of think they're resigned to having it.
It is challenging, but the reality is it can be done, and we see it. I mean, we see it in all of us here sitting, you know, today, and really showing and being role models for our kids, because kids are, you know, that's when they do start to pick up their habits. So I think after a while, it's just kids see it, they start to develop those habits. When they become adults, then their kids develop the same habits. But it really is a commitment. I say as a community, we need to work on this together. It's hard to do by ourselves. I think many times we do feel isolated. Kudos to you that you were able to walk across the country by yourself. But I'm sure you had support from people going along the way to keep you going. I think as a community, it would be good for us to rely on each other to help us through, diabetes and obesity.
Good. Thank you for being with us this
Thank you so much.
afternoon.
Thank you.
And you all look lovely, I must say.
Thank you. Thank you.
It's like you came to see somebody important.
That's you.
No. We're going to be right back.